The time being 5 o'clock, I'm going to call the Board of Health meeting to order. All members are present. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All may be seated. The first item on our agenda are public announcements, specifically announcements from the Health Division of the Inspectional Services Department. This time I'll turn it over to the Health Division.
Message on behalf of Kevin, just remember to please speak into your microphones when you're speaking. No major announcements from the Health Department. I do just want to let people know, we've got a number of people on my list to have their barrels replaced because they're damaged. Despite the fact that it was very warm and sunny today, the compost site is still under several feet of snow, and I can't access the Connex boxes where we store the barrels, so we'll get to that as soon as, hopefully next week, when we've had a warm weather. That's it.
Excellent. Any questions? Seeing none, we'll move into our lengthier discussion and action item list for this evening. The first item on our agenda is to vote and approve the meeting minutes of January 28th and February 2nd. Everyone should have a copy of those. Do I have any action?
I'll make a motion to approve the minutes from January 28th and those from February 2nd.
Motion to approve the minutes from January 28th and February 2nd by Katie. Is there a second?
Carol will second.
Thank you.
Carol seconds. Any further discussion? All in favor?
Aye.
Opposed? It's unanimous. Those are approved. The next item is Health Agent Report. Health Agent?
Okay, everybody should have a copy of the report, inspections, and mobile, gas station, Abington Ale House was a re-inspect, Mia Ragazza, Duncan's on Bedford Street, Martin's Bakery, excuse me, Portofino's, Wendy's, Honeydew, Sorrel, and Pizzangs. No priority violations this round. For complaints, I received a complaint on the 22nd for, actually got 3 complaints for rodent activity at Inspire Daycare at 90 North Ave. I did go and talk to them. They're aware of the mice. They have active pest control. They're coming in every week trying to mitigate the issue, so they are working on it. Received a call about a complaint for a bathroom leak in the apartment. Called the occupants back, never heard back from them, so presume that was taken care of. And then from 2:25 to 3:03, and actually continuing today, we've gotten various trash complaints. All I can say is I understand people's frustration. People seem to be very passionate about trash in this town. Our drivers are doing the best they can. We had an unprecedented snowstorm. The DPW has been working nonstop. It's very important, and this might not seem like it makes a lot of sense to people, but you cannot put your trash barrels on top of snowbanks. You can't put them behind snowbanks. The arms that come off those trucks are very strong and very heavy. They will smash anything around them, so the drivers will not put them into a snowbank. I got a picture from a driver of barrels up above his window on top of a snowbank. And I really shouldn't have to say this, but if you stack your barrels one in front of the other, whichever one in front is getting emptied, the other one is not. So again, I understand that people have limited space, but do the best you can. Our drivers are doing the best they can. And then for trainings and conferences, I attended an all-day seminar in Taunton today for Title V. That's it for my report.
Any questions from the Board of Health?
None for me.
No? All right, moving on. We have a discussion regarding local kratom sales. I believe we have a guest that might be willing to come chat with us about that. Because we have no idea what
No
it is.
pressure.
I didn't, I'm not, I'm super prepared, I just want, but I thought there was
Yeah.
going to be, I talked to Carol, and she said,
They didn't think the discussion was going to be too deep tonight? so-
It won't be, because
Okay.
I'll be honest with you, I have no idea what this is.
Okay.
So
Okay.
what is it, would be good, and kind of understanding what's, just a high level would be
Yeah,
good.
it is being sold in Abington. They call it like a gas station drug at convenience stores and local smoke shops. I mean, I can also, I have little one pagers on it, but my printer selects the days it wants to work, and today was not its day to work. So, yeah, I can read a quick little, kratom is a plant used in teas, powders, capsules, and other drinks. At low doses, it acts as a stimulant. At high doses, sedative or opiate-like properties. So people, it is highly addictive. Even when I went to the store that was selling it, they said, just so you know, it's highly addictive, and also it can cause liver damage. So a lot of other local towns have banned it. Some, I know Linfield, not super local, but Kingston, Marshfield, Canton, Weymouth is also trying to, and she mentioned Rockland as well. So I actually have Canton, the Board of Health, what they drafted and what the language and everything. And they, like I said, they voted to ban it from being sold.
Is there a copy of that we could get from you?
Yeah, I would, yep.
When the printer's up
When
and
the
running.
printer.
When the printer does
No,
work,
I
yeah.
can.
Or even digital copies,
Yeah,
right?
I guess, I can email everything. I have Chris's and Carol's email.
Yep.
Yeah, if you want to work
Yeah.
through
Send it
Chris
to Chris, and
and,
Chris will
yeah.
send it to us.
Okay.
When that
What
converts
Katie
stuff,
said.
my printer works
Oh, cool.
5 days a week. So.
Oh, awesome. It's not on weekends?
Usually not on me.
Okay.
Thank you, Melissa. That's
Yeah.
been,
Yeah.
that's really helpful.
Yep.
I did a little bit of
Yeah.
research as to why it should be something that the Board of Health looks at. And even though kratom is not the FDA, the NEA, the CDC, the American Psychiatric Association's addiction branch, all are looking at it as a drug of concern.
Right.
And so, but its legal status at the moment is it's unregulated.
Yeah.
And there's so many safety issues in addition to its opioid-like properties. Like, it's not where it's kind of packaged up and shipped out in Asia. There's contaminants like heavy metals. There's sometimes bacteria like salmonella that doesn't get inspected or looked at by any entity in the U.S. There's mild side effects. There's more serious side effects that I think people should be concerned about. Small number of quote-unquote overdose deaths, but they're often associated with multi-drug use and some drug interactions, impact on infants, neonatal problems, and the effects of intoxication. None of those things have been extensively studied because there isn't any kind of federal or, kind of push towards the research. So there's a lot of question marks about it, but I really appreciate your bringing it to us to consider.
Yeah, there was someone that reached out to me about it, and she said there's a group of moms that are concerned about it, so I said I'd bring it up. Yeah, it seems like you have more research on it.
Yeah,
than
that's what
me.
I did today.
Yeah.
Okay. But the FDA says it cannot legally, lawfully be marketed as any of these things, a drug product, a dietary supplement, or a food additive. So that's part of the problem. A lot of the packaging says it might be one of those. It's highly, highly available
Oh, yeah.
online. So-
Right, and the store I went into, I asked for it and was like, oh, see this big shelf? This is all kratom.
Wow.
So, yeah, kids know about it too. And I've
Sure.
heard from other community members that they know someone that's having a problem with it. So, like I said, highly addictive, so,
Right.
yeah.
Well, if we can get a copy of that
Yep.
language, I think it's something we can at least look at how that's worded, if that's something we want
I
to
would
do
like
and
to,
move
yeah.
forward with that. So if you can get us that copy, that'd
Oh,
be
yeah,
great.
I'll email it when I go home.
Wonderful.
All right, thank you very much.
Oh,
Yes.
Do you know where the state of Massachusetts stands on it? Are they moving towards the regulate? I mean, right now, it sounds like each town is doing something. individual.
Something, yeah, the state
Federal.
is not, they think eventually the state is going to, but it's,
We're also still on the 2013 food code, so.
Seems slow to respond to that, but,
Yep.
okay. Probably not enough
right.
studies, I guess.
Thank you.
Thank you.
Thanks for coming in, Melissa.
Of course, yes, thank you. All right, moving forward, a vote to adopt posting methods for the Public Health Excellence Collaborative Governance Board in accordance with 940 CMR 29033. What that is, for those of you that are not aware, Public Health Excellence, we're part of a collaborative. If you look at Chris's shirt, he's got an awesome little PN5 logo on there. So that is the group that we are a part of. There is now a governing body, or a public body, as it's now defined, that meets as part of that. Under open meeting law, every town needs to post for anytime they have a meeting on their own, which is kind of a little excessive over time. So each public body that falls under this jurisdiction, so for example, the Board of Health of Abington, can approve an alternative posting method, and I'll read what the verbiage is in a moment, so that they can just post through Brockton's posting method, and that is sufficient, instead of them having to post in Abington and post in Brockton and post in every other community as well. So what this is asking us to do, the open meeting law, which is that 940 CMR 293, says that as an alternative method of notice, a regional or district public body may, by majority vote, adopt the regional or district public body's website as its official notice posting method. And it goes on to explain how the notice will be kept by the chair in accordance with applicable records and things of that nature. So, long story short, the Region 5C, not Region 5C, that's a completely different thing. PN5 has asked us to vote to allow them to post through the City of Brockton's posting method for their meetings. Do we have any questions about that?
Yes.
Yes.
What are we to post?
Their agenda.
Our agenda?
No, their agenda. Because they're a public body that represents Abington. So they would need to post an agenda in Abington. So instead of them having to post it here also, they can post it in Brockton. And that suffices.
So we're under their umbrella.
Correct.
So rather than duplicating the posting, we're just doing it once under the head of the umbrella.
Correct.
Can you just give example of, again, what kind of agendas they would have that we're part of? Like,
Any time that group meets, they have to post an agenda. They would have to post it in Abington and Brockton and every other community that is a member.
but they're all things related to health board type stuff?
Chris may be able to elaborate exactly what goes on in that meeting.
Yeah, it's a shared services group, so it's Avon, Abington, Brockton, Stoughton, and Whitman. We have representatives from each town. I'm Abington's representative. We are looking, the main thing that the board is discussing right now, they're looking at hiring a shared services inspector. I want to say social worker, but we're not supposed to use that term. Health educator, and an epidemiologist and a public health nurse that would be shared amongst the group, so.
This wouldn't take over for your position, though.
No. Like right now, we're using Allsco for some of our inspections. They're a consultant, but the PHE wants us to move towards having a dedicated inspector. So it would just be hiring somebody amongst the group, not the town of Abington, but the group hiring somebody to take Allsco's place.
And this particular thing is a pretty standard ask. This is not unique to this group. Other public health excellence groups are doing this exact same thing and posting under one umbrella. So this isn't just us that's coming up with this. It's just
Right.
it's an administrative process we have to run through.
So this PHE Collaborative Governance Board is made up of representatives from each town, and that's it? Or is there a state level?
Yeah, that's it.
That's it? Okay, so there's someone from the 5 towns that are covered.
And I think part of this will probably touch in when we talk about PHE in a little bit, but explaining I think a little more in detail. But the specific to whether or not will we allow them to just post to the City of Brockton through their posting method on their website. And we can have, I think we're required to, as part of the way that that's worded, is have some sort of link on Abington's town
That's what my
website
next question was
to go and view that information. So we don't have to go post it on the glass out front for them, but people can navigate through Abington's website
Oh,
and find that
okay.
information.
All right, that makes more sense.
So,
And just for the record, this is not a new group. We've been meeting for 5 years.
Right.
We're just now a public body.
Right. I just wasn't familiar with it. That's why I was asking more questions.
And like I said, I think we'll talk a little more about the specifics of that in a little bit, but on this particular matter, if there aren't any other questions, do I have any action?
I will make a motion to vote to adopt the posting methods for the Public Health Excellence Collaborative Governance Board in accordance with 940 CMR 29.03-3. That is a mouthful.
You just wanted to say it, right? So I have a motion from Katie, do I have a second?
I'll second that.
Second from Lisa, any further discussion? All in favor?
Aye.
Aye.
Opposed? It's unanimous, that's approved.
We're also saving the trees,
Yes.
not putting
Yes.
so much paper and putting it on.
5 things, yeah.
All right. Moving forward, this is a pickup of an agenda item we had at the end of January. It's an approval of tobacco retailers, of a letter to tobacco retailers regarding the FDA marketing granted order and authorize the Massachusetts Health Officers Association to incorporate those products into retail inspections in accordance with the memorandum of understanding that we have with MHOA. So if everyone recalls, we got a lovely packet a couple of weeks ago. I don't know that a second version of that has made it into this particular packet, but everyone should have it from previously. The Massachusetts Association of Health Boards does compliance inspections for us. There was a notice that went out from the FDA reminding about products that can and cannot be sold. For tobacco products, they have to have a marketing granted order in order to be sold. So the ask right now is by the Massachusetts Association of Health Boards, Massachusetts Health Officers Association, if we would like to include spot checking whether the tobacco products that each retailer sells are have received marketing granted orders. If that's something that we want them to check. That is the ask. There was a sample letter. The sample letter that was provided to us before is the same. We haven't made any changes to that. It would be plug and play with the town of Abington is listed, and informing retailers that, hey, make sure that all the products you have received a marketed granting order by the FDA in order to sell. Any questions on that?
No, I just wanted to, I found the actual letter, and it's focusing on e-cigarettes and nicotine pouches, right? It's-
Right, yeah, a vape or an oral pouch. With all the discussion about tobacco we've had in the past 2, 3, 5 years now, the language changes every 5 minutes, so
Yep.
thank you for pointing that out.
And how
Yes.
much notice were we going to give them? I think that was part of our questions last time.
Well, I think if this would go out as soon as possible, and then when MHOA does their inspection, it would just be included the next time, so could be 2 weeks later, could be 6 months later, it just depends on when they're gonna go out.
Oh, I
It would
see.
be FY '27.
Oh, would be, okay,
Say it again?
so,
It would be FY '27, so it would be after July.
after July 1st.
Okay.
So, that's even better.
That's a lot of notice.
Yeah. So this would go out, if we said okay tonight, as soon as possible, Chris?
Yes.
So, I know we had questions, people wanted to do research, things like that. Did anything come of that we want to discuss? Or?
I just wanted to make it notice that it was different from the tobacco that they always do. So, and I didn't see any, but I did want a chance. So I did. I didn't see any discrepancy. I didn't see any lobbyists that would be coming at us. Because that's very uncomfortable.
It is, it is. I think we were together for one of those
Yeah,
times.
yeah, it was really scary.
Yes, it's not fun.
No.
So, if there are no other comments, questions, do we have any action on this?
I'm going to start, I'll do it. I'll make a motion. I was in favor of it when it first came across our table. I think any method to, keep tabs on what's being sold and prevent it getting to youth is ideal. So I will make a motion to approve the next one. Discussion regarding the proposed rules. Oh my gosh.
Number 5.
Thank you. To vote to approve the letter to tobacco retailers regarding FDA marketing granted orders and authorize MHOA to incorporate these products into retail inspections in accordance with the memorandum, blah, blah, blah.
Thank you, Katie. Katie's made a motion. I'm not going to repeat it. Do we have a second?
I'll second it.
Second from Carol. Any further discussion? All in favor?
Aye.
Opposed? It's approved. All right. Next, we're going to give Chris a little bit of time to talk about SAFE 2.0, the State Action for Public Health Excellence. Everyone should have a copy of the guidance document. I don't think he's planning to read verbatim, but kind of give us a high level. Hopefully that kind of guides some of the discussion we had and some of the discussion we will have later tonight.
Okay. So, long story short, back in 2016, Massachusetts legislature was looking at the standards of all our boards of health. Massachusetts is a commonwealth. Every town and city has their own, so there's 351 separate boards of health in the state, all with varying standards and compliance. And they realized that something needed to be done about that. The 6 key findings was that most cities and towns couldn't meet the current statutory and regulatory requirements and lacked capacity to meet more rigorous public health standards. 351 separate boards of health, despite evidence showing that shared services can improve effectiveness and efficiency. Most importantly, that there is no statewide data system to collect local public health data and measure the local public health system's performance, and that a lot of the workforce lacked a uniform set of standards and credentials, resulting in inequitable service delivery across the state, and funding for local public health is inconsistent, inequitable, and insufficient to meet the needs of a 21st century system. So, SAFE 2.0, well, SAFE 1.0 originally came aboard. And that's the State Action for Public Health Excellence legislation. Basically now law standardizing what boards of health do across the state. Boards of health, which affects us, the requirements is that we need to meet performance standards, including workforce standards. Each board of health must meet performance standards individually or through cross-jurisdictional sharing, with the option to join a state-supported public health excellence shared service collaborative, which is what we were just discussing, the PN5. Performance standards include, but are not limited to, standards for the following: inspections, epidemiology and communicable disease investigation and reporting, local permitting, and that workforce development standards, including education, training, and credentialing, be developed and adhered to. And then finally, we submit a report to DPH each year by August 31st showing compliance with performance standards. So fortunately for Abington, we are part of a collaborative. That's the PN5 that we just talked about. We are mostly in compliance with the performance standards. As far as the workplace, I have all my certifications. There are new ones being developed, and as they're developed, I'm taking them. The local public health training for housing and food has 3 tiers. First tier is self-directed training, second is a classroom, third is just they go out in the field with you. So I'm at tier 2 on both of those, just trying to schedule an inspector to come out with me for inspections. They are developing a new system called Metric, which we're going to use for reporting. I'll be trained on that as soon as it's available, and then we will be reporting on our permitting and everything else to the state every year. That information goes to DPH, then DPH presents that to the state legislature. So that's SAFE 2.0 in a nutshell. It is now law, and we are expected to follow that. There are consequences if we can't meet the minimum standards. We ran into that when the health department was dissolved and we became part of inspectional services. There are certain things that the state requires for us to be able to participate in the shared services group and the public health excellence grant. We fortunately meet that criteria, so we are still part of it. If we were not meeting the standards that the state has set up with the reporting, the consequences of that eventually would be a reduction in state funding. And I think we all know where we are with funding from the state right now. It's important, but we are positioned between what we have here in our own local board of health and our shared services group to meet our standards. So we're in good shape.
Yeah, and I would want to point out one of the things that had come up in discussions about SAFE 2.0 was that some of us implementing any of the performance standards would become an unfunded mandate, which under that law, we don't have to do that. It's actually written into the law that the Department of Public Health and DEP must fund the boards of health to implement those performance standards. So we are allocated funding through PHE to make those things happen. So if we're trying to implement performance standards as required by SAFE 2.0, that is law, we do have the mechanism through PHE to do that. So it's imperative that we do the best we can to meet the performance standards to make sure we maintain the funding. It's kind of cyclical. We get the funding to help us with the stuff as long as we meet the thing. But it's just even more the reason that if we're so concerned about the dollar and the bottom line, that we continue to meet the standards. That's important. So I wanted to just punctuate with that.
Yeah, thanks for that comment. It just seems like utilizing the shared services that are available is a big part of this too, right?
Yeah, and one of the things that we have to bear in mind, and I think this is what caused some of the issue earlier, is the funds that we are given through the state grant for this are not allowed to be used to supplant local funding. So in a nutshell, the town can't decide to cut the budget of the health department and use grant money to supplement that. It has to be in addition to, it's to bring us up, not to keep us level. So it's offered the ability to do additional trainings. I was able to go to, I think, 3 conferences last year instead of the 2 that usually would be within our education budget. We've updated all the equipment that we use for inspections. That was all stuff that was not budgeted by the town, so we were able to use the grant money to get us up to where we need to be for that.
They don't need to become capital projects to adjust those things and approved by town meeting. They can just get done and keep us at a high level, high
Love
performing
that.
level.
Yeah, it's been very helpful. It's a good.
So even the Matrix software, they're covering the cost of implementing the software or all of that?
Yeah, currently, and that's actually was a boon. So the software that I use for inspections, the town was paying for out of the town budget. We were able to move that over to the grant because 4 of the municipalities in our shared services group are using the same software. So we not only got a price break, but we took the payment for that out of the Abington and put it into the shared services group. So saved us some money.
Well, that's good.
Any other questions or comments on SAFE 2.0? All right, we will move forward into our bulkier discussion of the evening. Discussion regarding the proposed rules and regulations for governing horses and stables. This just continues to be a conversation as we go through. I know probably the more interesting one is the next one. And quite frankly, part of the discussion I kind of wanted to point to tonight, I'd love to hear what the rest of the board's takeaways were from the public hearing related to this particular regulation. I know we have plenty on animals as a whole, but this is still a part of this discussion. And I mean, most of the conversation that we had ended up having, in my opinion, leaned towards the overall disapproval of any regulation, period, which we can get into the philosophical discussion of whether we need to do that. But as it pertains to how this regulation is written and what is here, I didn't see a lot of objections specifically to horses. It was mostly to animals, and it was mostly to regulations as a whole. But I'm just one read on this, and I want to have that conversation a little more and figure out what we're going to do with this, because we have this stable fee that is now embodied in the town's bylaws that we need to address somehow. And this was a mechanism to do that. So I'd open it up to the rest of the board for discussion.
The only theme I was hearing through some of the opposition was that it was redundant of what the state of Massachusetts already has set up for barn inspections on an annual basis, which when I remember when I was reading it online, it included something about census of the animals. So I just wondered if indeed it was redundant of what we were trying to do with horses and stables.
Yeah, and I think the horses and stables, as it's written, was actually less concerned with knowing how many animals there were and just having standards, because we needed to license them per state law and per the performance standards. So that may happen, but that wasn't the intent of this particular regulation. It was of the animals regulation. My opinion, not. Because of what's written here, I mean, we can talk about knocking some things down and out.
We've already done so much of that.
We did a lot of that with the other regulation. We haven't really done anything here, and I don't know if this is something that we just need to kind of tackle as we did with animals, and we'll talk about in a minute, and have somebody else tackle it. I mean, I composed a lot of what's here with aid from Plymouth, so I would delegate that to somebody else to maybe take an axe at it if we wanted to do anything in particular, but a lot has been cut by the town council here, and
So
As well.
just for clarification purposes, and I
Yep.
think by putting both of them together on agendas and meetings and public hearings, I think there's a conflation of why we're doing both of them
right.
for very, very different reasons. And so you just clearly said, and I just wanted to repeat it, that we're doing it so that we're complying with state law, so that we have a mechanism that helps us comply with state law in terms of licensing.
Yeah, we have to set a fee for stables. Look, all stables need to be licensed by the Board of Health, and we need to set that fee at town meeting. We've done that already.
Yep.
But we don't have a mechanism to license the stables.
Right.
So this solves that problem.
So this particular regulation is something that just kind of like, we just needed to dot the i's and cross the t's on
Right.
fulfilling what we've already done as a town.
Correct. And I am perfectly open, this was a model, so there are things in here probably related to where stables and corrals can or can't be in specifications that I'm not married to as a concept. If there are genuine concerns that they shouldn't be there, or we want to remove these altogether and just say they need to meet zoning laws, like, sounds wonderful to me.
Like a one-page thing that just says they have to,
I mean, it's probably going to be more than one pages, but yeah, I mean, I don't know that it needs to be this long per se, you know, and the whole, we got into this a lot further than we intended because
Right.
drafts get out and people think things are more than they are. This is one of those scenarios where this was a draft, we started looking at, we started making cuts to, and then we're expected that these things are going to go into effect tomorrow, and they're not. So if there are things in here, I'm not married to all of them. I just would like to see that we have a mechanism to license stables as we voted at town meeting, so.
there was a really valuable resource woman who came to the public hearing meeting who I would love to have take a perusal of them as well. I can't remember what her name was, but she,
Was she the county person?
yes,
Yes.
that one.
Meg Ryan.
Yes.
I remember because she had the bright green.
Yeah, Lisa. Yes.
Yeah, she was the county agricultural educator and just seemed to have a lot of knowledge
Valuable information, yes.
about, because she does a lot of work with the town, individual town inspectors.
So there's a Meg Riley and an Erin Ryan.
Not, it was the second one, the Meg
But
one.
they were talking about the animal regs and not the stables.
I still think
She
might
kind
be
of combined
helpful.
it, yeah, in her,
Most people conflated both into the conversation,
Yeah.
which I understand how it's confusing. At the same time, I don't know how else better to do it than to have people come out 2 nights in a row, which seems like a waste of time.
so,
But
Did you get
it may be worth our,
information
wo-
by any
okay.
chance? That
I think,
one?
yeah, I think I have it.
If you give it to me, then I don't mind taking the next step. I kind of want to reach out to her, I want to look at it, I want to look at it with fresh eyes, because this was all pre-animal regulations, and now I feel like I
Yeah.
want to look at this all with a once-over once more.
Yeah. Good idea, Katie.
Yeah. Experience, you know.
Agreed. I think it's worth noting, if you don't mind interjecting, and unless it's changed in the wording, these regulations, we have like 3 or 4 horse stables in Abington. And I believe this draft of the regulations grandfathers all the existing ones. So effectively, these regulations would only be affecting anybody that was going to build a new stable. And I would think that we would be remiss not to have regulations for somebody who's building a new one.
Yeah, of course.
yeah, and actually, I was going to basically say the same thing, is that I don't know that this needs to be done tomorrow. And like, if we want to table this conversation, if we want to bring in an expert and do that, I don't think we're in danger of being worried about somebody wanting to build a stable tomorrow. I think if anything, the animal regulation, because Right to Farm is on that we should have this discussion and try and move something along with that. But horses and stables, if we feel we want to table this discussion even until later, even after Right to Farm goes and has that conversation, I think that would be okay.
And I feel like because the fee is already set, that I just want to make sure that pressure-wise,
If someone comes and they want to license a stable, then it can be addressed ahead of time. But is
Okay.
that going to happen between now and May, when the town meeting happens? I doubt it. It's kind of cold and the ground's frozen, so
Right.
we could wait and see where that goes. And all right, then Right to Farm is a thing in the town of Abington. We need to have something in place. Then we address this with, you know, a fresher set of eyes now, because we know that the law has expanded for farms in the community. Maybe we've done something with animal regulations that changes what we actually need as part of this. because they can work in tandem, as opposed to being two separate things. We can cut some things out, and maybe that's the way we approach it.
I like the idea of not tabling it, but just taking some additional time, like I'll need some time to coordinate with this individual Meg. And I kind of want to I do want to start from scratch a little bit. I've been doing research on the right to farm stuff and I'm nervous about it, but that can be a conversation for another day.
Katie, I totally agree, and if you want any help trying to sit with Meg. The
Thanks.
other person who seemed to have really strong opinions, but also be a subject matter expert on it was the first person, I looked at, his name was Joshua Kimball. Those two people seem like they could be good to meet with.
Yeah, I agree.
And see,
A
we
little
could like
powwow.
trim it way down because I think a lot of it is already repetitive of something that the state has. And maybe we could just trim it really well down with their advice too. So before we bring this back to the agenda, we should take time to meet with those two.
I love that.
Okay.
The one thing I noticed was, and it seems like we keep pulling out the exotic thing, and somebody keeps putting it back in, which is kind of attacking one business in town, and I don't think that's appropriate at all. Because that particular business has a niche market, and it gives the town a lot of our public safety personnel saves time just by their mere existence.
I think we agreed with that. It was just the way it was written.
It just keeps coming, it seems to me, and I'm just gonna say it, that legal keeps putting it back in and we keep taking it out.
Well, I'll address that when we get to that agenda item, which is the next agenda item.
Okay.
Because I think I figured out why that happened, but we'll talk about that.
But it did happen.
Oh, it happened. It happened. Trust me,
And
we
because,
know it
when
happened.
people are waving the red
Yeah.
font at you,
Right.
Which was the legal.
Yes.
But I don't think it was part of the horse and stable.
Right.
No, but still.
Horses are exotic to me, but that's because I don't know anything. So and what is the pleasure of the board on this? I mean, I'm willing to, I think, let this conversation on this particular item go for now. That would be my opinion.
Postpone,
Yeah,
but
table
take
it.
some
Yeah.
time to do some legwork.
I think we could keep it on the agenda, and if we have to table it one more time, because it's going to be at least 2 weeks before we meet again, but not to lose it completely. We don't have to make a motion, just say,
Yeah.
we'll investigate it further.
Yeah, I think if we want to dedicate some time, and if we wanted to, even at the next meeting, if we think we could get an expert to come and have a conversation with us, if somebody is willing to coordinate that, let me know and we can put it on the agenda as part of a conversation. I have no issue with that at all, and it's definitely, we're never expected to be experts in anything. That's not required by law to be on the Board of Health, but we are expected to rely on the expertise of the people around us. So if we can bring people in, then we should do that. So if that's something we want to do, or we
Can
think we
we
can
also-
engage. Yeah.
Trim down the draft that we have that has all the red ink on it, clean it up the way you did for the animal one.
Yeah,
So it's
do you
easy.
mean this one with the blue for the horses? We're selling that?
It turned
Okay.
red in
Mine's
another
red.
copy.
Mine's blue, I don't know why.
Yeah,
different
it
colors.
would be a little easier to read after we
Yeah, and we can,
meet
with the track changes too, we can shut that off, because there's a whole bunch of stuff that's crossed out, but it's still in here, because,
Yeah.
so this is probably at least 2 pages shorter, that way. All right, so it'll be on the next agenda. We're gonna kind of move this slow, I think will be the way I'll word it for now. We'll move forward. Animal regulations, this one we'll spend a little more time on. So everybody should have a copy of a proposed draft that I have created for the animal regulations, based on some feedback, based on several different things. If anybody would like a copy of this draft that is marked up, there are extra copies up front. So several different pieces came out. I think it'd be difficult for me to read verbatim all the things that happened, but I'll try and give the synopsis. Can never say that word correctly. So section 1, I kind of simplified a few things there, citing only regulatory authority. Talk a lot about statement of purpose that ended up in section 1 that should have ended up in section 2. I added in a thing in the statement of purpose that would aid future Board of Healths in making their decision. And it's a sentence at the end that said this regulation is not intended to restrict lawful animal ownership, agricultural activity, commercial operations, or personal lifestyle choices. And that essentially intends those people that maybe have certain opinions
Knee-jerk
about,
reactions.
whether it be vaccinating animals that they're going to eat, things of that nature. It allows some flexibility for the board to make those decisions in the future. In the definitions, and it'll make sense as we go through, but certain things were cut. That includes corral, feed management plan, keeper, manure management plan, pest management plan, and in the definition of wild and exotic animals, the sentence, "wild and exotic animals are prohibited in the town of Abington," was removed. Now, oftentimes, what seems to happen when town council creates things is, this is an amalgam of draft regulations that were from different places that we brought together. Town council takes regulations that have already been approved in other towns that they believe would be held up in the court of law because they've approved them, and then insert the same verbiage back in where it may be missing, instead of going through to check and see if it's actually where have we ever prohibited wild and exotic animals before. We've never done that. We don't intend to do that. But the town council is only supposed to, in their wisdom and expertise, actually adjust the not the content, but they're supposed to adjust the form and the things that are in there so that it's legalese, not the content itself. And that is not what happened here by accident or intention. It's not the way that we should be doing business.
Well, I found it particularly frustrating because we've said
Over and over and
over and over again. And particularly said, no, this is definitely not going to hurt you.
Right.
And I feel like an idiot sitting up here and have it come back again. And it's very frustrating.
It is frustrating.
And it was hard to go through that and say, well, we didn't put that in. We've been taking that out and not be able to respond to that immediately. So I wanted to take the opportunity right now to say that this is exactly not what anybody meant to do.
Right. And it's not what we're going to do. This board is not going to do that.
No,
And Susan, even, that's why I put in here, it's not intended to restrict commercial operations of anything. If and let's just call a spade a spade. It's Joe's Crazy Critters is the issue.
Right.
So and I'm just getting frustrated, not at you, but it's that we are sick and tired of hearing people say that that's something we're going to do. We're not doing that.
right.
End of story, right?
We multiple times, at like a month's worth of meetings, said that we
Right.
didn't feel like we had any control over the exotic animal bit, that it was already governed on its own, and we didn't want to have ownership of that, so, yep.
That was frustrating.
It is. Well, so I'll address that a little more. So we go into section 4. I've removed the sentence that says, on a statement that says on an annual basis, and I'll explain in a moment. I also added some verbiage that essentially says that anything, any way that this regulation is implied that would cause undue hardship on individuals, that it can't be implemented in such a manner. The exceptions, which would be section 5, I added in that wild and exotic animals shall be exempt from the regulation. In plain English, that they are exempt from the provisions of this regulation altogether because they're governed by state law. It says, including but not limited to Mass General Law, Chapter 131, 31, and CMR 9. So,
Yep, I want that in there.
I'm sorry, and 321 CMR 9. So it's very plain as day that we're not intending to do that. There was some language related to the board may impose a permit where animals are kept in unreasonable numbers or conditions. While I believe that that's important, that's also already covered in other nuisance-related things that the Board of Health would have to answer to anyways. I can think of at least 2 occasions that Chris has had to go to places where animals were kept in bad conditions or in excessive numbers, and they were still handled. It doesn't mean that we have to do something for it here, so I think we could omit that and it would still get resolved.
Do you agree, Chris?
Yeah, a nuisance is a nuisance.
Okay.
And I'm just going over kind of the high level so everyone can hear, and we absolutely have a discussion about it. I just want everyone to hear what's in this document we're looking at. In the registration itself, number 6, it kind of changed the verbiage to instead say that animals are to be vaccinated, required, et cetera, and they need to provide proof. It becomes an attestation that all animals are vaccinated and tested in accordance with requirements, if applicable. There are some animals that maybe that doesn't apply to. They don't get vaccinated, something that I learned from some of the individuals that were there. So if it's not applicable, if they're not required by MDAR and the Division of Animal Health to do that, then what are we going to make them do? That
Right.
doesn't make any sense. The feed management plan, one of the most common complaints we seem to get was that the feed management, the waste management, the pest management seemed cumbersome. So I think what we expected versus what people were perceiving were two different things. So I've adjusted the language here to clarify that a brief written description of how the applicant will safely and sanitarily manage animal feed, manure, and pests to prevent odors, rodents, insects, runoff, and other nuisance or public health conditions. This description shall be concise, practical, and proportional to the scale and nature of the animal use. So, and we get into interesting territory, right, where this is an area where right to farm would then talk about certain agricultural practices negating things being considered a nuisance. So that's a situation, though, where we can say practical and proportional to the scale and nature of the animal use. Well, it falls under right to farm. We don't need every scenario of things that they don't now need to consider a nuisance as long as they're doing it properly. They can say that they're participating in the appropriate agricultural practice, and that covers what that
So
is
you're
expected in
asking
that
for all of
section.
those things, you're just not putting a scary title on it.
Correct. Yeah. It's give me a paragraph of all the things you're doing, and maybe it's longer if you've got a bigger plot of land that has animals, and maybe it's smaller if you don't. And then number 8 on here, where it says a plan of the facility, I have changed the word to a simple sketch because people were afraid of plan and thinking it was going to cost several $1,000s. That's not what we expected. Sketch sounds a lot less scary. Okay, the next few things seem longer, but I promise is actually shorter. So when it comes down to the fee, there were a couple different avenues. I've made a suggestion here, and I want to have this conversation, that the fees should be determined by the Board of Health's fee schedule. I think that that is the right way to handle it, as opposed to putting a written number in the regulation, because every time you want to change the fee, you got to change the regulation. We can put it in the fee schedule, that gets reviewed on a pretty much an annual basis, and we can adjust it at that time. If we're probably going to have the most bulk of people participating in this up front, then in my opinion, it would make the most sense that like we're kind of doing with horses, or we intend to, that if the existing stables are going to be free and we're just going to give them a license, then we should do a similar thing here for the first year or so of people doing that. We were talking about doing a low enough fee anyways, so $5, but it seemed like $5 was still bothering people, and I can understand, okay, it's another thing I got to pay for, fine. So my feeling was that at least for the first year or 2 years, whatever it may be, that maybe we waive that fee and we can reconsider it in the future at another time. I also am making the recommendation that we make the registration permanent until the with any changes in animal numbers, species, conditions, that be reported. They have 3 months to report those changes. It's a lot more
Seems fair.
laxed. I think we had originally talked about a permanent registration. This was probably, yep,
Aaron, I don't know what you mean by that. You're saying not an annual thing, that once you register them, they never have to come back and do it again unless there's significant changes?
correct. Yep. That was what we originally spoke about. That was the original plan, probably 2 years ago. And then, again, we've gone through 15,000 drafts of this, so annual became part of it. Wasn't the original intention of the original board that looked at it. This board may feel different, but it is a suggestion, not what I'm saying we have to do. If we, where are we going? Sorry,
I think
go ahead.
it still works, sorry, I want to chat that
No,
one out a
please
little
do.
bit. I think that works with like the whole concept that we had about it being a registration and not a regulation, where you just want to know who has the animals, and so that is kind of ticking off that box. And a lot of the animal owners that I had spoken with, like that was one of their biggest concerns, like their chickens get eaten by foxes. Am I gonna have to come and like tell you I'm down 4 chickens in order for it to be up to code? So if they're just doing it and saying that they have the animals, I kind of like that, and that way there's no pressure unless it's like big changes.
I was just thinking human nature, if you just say you only have to do this once, they're probably not going to remember to keep us updated with anything else. But if it's minimal fee or free, not even a fee, like if you just say, fill out, registration once a year, I think that'll keep it fresh in their mind and fresher in our, more accurate in our roster of the animals.
Yeah, I hear you. I hear what you're saying. I think I like the one time because then it alleviates pressure. They're like, oh, I just have to do this once, and then it makes it kind of less stressful. But I hear what you're saying too, Lisa.
Oh, sorry, Carol, go ahead.
I have a lot to say, so do you want to finish?
And then start over.
Yeah, well, and I only have a few more brief things anyway, because we're almost done with that, so
Yeah.
if you want, I can finish that. But before it escapes me, because we're having this conversation, my thought process was more, I don't know that it matters now that we've had this conversation as to what the exact number, species of the animal are, because if the intention is to allow the health agent to do some education, then I think just simply knowing that there are animals there might also be sufficient. So that was the thought process too. But I just want to get that out before I. So last few things, there was a lot of language here related to corrals and live fowl and when they could be attended, when they could be unattended, et cetera. We weren't looking to regulate any of that to begin with.
Exactly.
The enclosures were supposed to be approved by the Board of Health at every juncture that an enclosure is put up. That's ridiculous. That's not what we were intended to do. So the language has changed to say that animals shall be confined with sufficient to prevent escape and nuisance conditions to ensure animal safety, as long as they're approved through zoning, building, and other municipal permitting processes, and shall not require separate approval by the Board of Health. There's that. Severability left intact. I completely nixed the enforcement sections intentionally. We intend to educate residents on certain nuisance conditions as they pertain to whatever it may be. I'm kind of talking
Or
into a hole.
disease management.
Correct, but I think each situation's a little different, and we're not looking to get in the business of whether people have their backyard animals set up correctly. So if we impose an enforcement, look, if somebody doesn't register their animal, all that's going to happen at the end of the day is it's going to make our health agent's life more difficult, and they're probably going to get a health agent knocking on their door and having a conversation. If they want to make their lives more difficult that way and go through that, that's on them. We can find people all we want. I don't think it achieves the aim. I don't think it does anything for us. What this allows for us now, which I know seems counterintuitive to completely remove enforcement, but it gives the health agent a mechanism to collect this data without having to say, I'm just doing it for zoning, I'm doing it for building. We're requesting that he does this for a reason, because there is a nuisance that keeps coming up in town, whether it be rats, whether it be bird flu, et cetera, and we have no way of adequately educating and enforcing any of those situations without having to go and visit people and it actually take more time out of your day. So I think if we can at least provide the mechanism, we're achieving the aim, and that doesn't require us to charge a penalty. So my opinion on that. I know I read a lot. I'm going to shut up. Specific things, conversation, let's have at it.
Okay. May I? I have
Yes.
quite a bit to say, and I thank you for going through that and explaining why you left things and took things out, right? One of the things that I did was I went to the dictionary. Some of you know what that is. It's a book. And I looked up the word regulation, and one of the many nuanced definitions of a regulation is a guide to ensure safety, fairness, and efficiency. And what I've been reading through all of the iterations is corrections, inspections, and penalties, and all the things that we never really wanted it to be.
Right.
So I kind of started going through with a very different mindset that this should be something that people want to participate in, right? And so in that first statement of purpose, we say, well, it's not intended to do, but we don't really spell out what we intend it to do. So I wrote up something, and I'll just read, and we can ditch it or pitch it, whichever. This regulation is intended to develop a simple voluntary registry of residents who keep non-domesticated animals and who wish to be contacted in the event of situations in which the health and safety of animals and nearby humans may be affected. And that was kind of like at the core of how this all started since I've been on the board. Just the goals of public health are to look after the health of people, not to punish, not to discourage. And so I just feel like we might be coming at this from the must-have teeth or is not a regulation belief to something that we, instead of saying you have a permit, you're a registrant. You're a person who wants to register, who wants to be part of the community of animal owners in the town. Because what I heard over and over and over again are people who were saying that they don't like this idea of being directed and inspected and punished and fined. And I mean, this, you know, the word enforcement is still in there, but I just feel like we might want to just think about it from that perspective of people registering so that we can do what public health does, which is to educate and protect and encourage safe behavior. We've heard animal owner after animal owner saying, you know, they know a whole lot. There was a 15-year-old girl who knows more about raising chickens than I'll ever know. And we're not trying to discourage her at all. So I think that if we kind of look at it as more guidance rather than we're giving you permission to do it, because people are doing it. Right? And people may.
We're not trying to stop them.
Yeah. And, you know, so for people who are wanting to register, I mean, instead of calling them permit holders, and that kind of takes out the whole need for fees. In the form, like several iterations ago, I had drafted up a form which has all of this same stuff on it. And, you know, it got blown out of proportion because of the version that was available for public consumption, that, you know, attestation of whether you're, you know, keeping your animals safe and healthy. I mean, that's why most of the people are doing it, right? And then, you know, this idea of just like what part of the yard is the chicken coop, just in case it might help in if there is any kind of an emergency, right? You know, emergencies might be uptick in the bird flu, and it might be things like, what if we had a chem spill and people had to evacuate? Like, what could we as a community of registrants do to support each other for, you know, kind of protecting the humans who live there, but also their animals? So, you know, I just think that and I heard it over and over again, you know, government.
Overreach.
Overreach, that's.
Overreach. I read it over and over again.
And, you know,
Overreach.
I think we can make this really simple and very, like, community-focused rather than us versus them focused. So that is all I have to say, and I have lots of notes on this wonderful document that I think, you know, if you just kind of look at it from a different frame, it might be something that people will either do or not do, which, you know, right now they're either owning animals or they're not, you know, or they're telling us or not. And we have a lot of subject matter experts in the community that could, you know, be part of this, right? I don't know. So that's me, and I'm just going to hand this over to whoever else wants to respond to it or move on to something else.
Sure.
Thank you.
Thank you, Carol. And Erin for trimming this down so well. It's so much easier to work with. And I agree with everything Carol said, and some of my comments are more semantics. Like if we're gonna have this be more of a registration, let's completely get rid of the word permit. You don't even have to put those two items with permit in the definition, because it doesn't have to come up ever again in the body of it.
Registrants.
They're registrants, or they're going for a registration. I did have, I agree. I think
Yeah.
you
Yeah.
might still be
Yeah.
giving a little bit of the wrong implication on a couple things that you don't mean to. For example, under number 5, exceptions, well, exotic animals shall be exempt of this regulation, provided that all the well, that means that we've just taken responsibility of finding that out. So I think it should say the same thing, but say, but need to also follow all applicable things. You know, not that we're going to regulate it or look at it or go inspect you, because Chris doesn't have those kind of hours. So can we just change that sentence a little bit, instead of saying provided that,
Yeah, we can.
and say,
I
but
think-
they still need to follow, or something?
Yeah, and the only reason I wanted to include that mostly is because I think there are specific animals that are considered wild and exotic animals in that. I don't know what they are, and that could change. So that's why that's a reference. We could adjust it to say that that's the purpose of including the language.
Yes.
Even, but
Of course,
I
they still
agree
need
with
to
you.
follow all the applicable federal and state permits and stuff. It's just that we're not going.
'Cause they
to-
could-
We're not going to oversee that.
Yeah, and my thought would be is if there was an animal that's considered wild and exotic today that isn't tomorrow, maybe we want to know that in the future. So
Yep,
that
because there's a
provides
new
that.
animal, there's a zonkey. It's a half zebra, half donkey.
Those things are pretty cool.
Yeah, but I mean, that might not be in your list of exotic animals now.
Yep.
But I
Or
fully agree
yesterday.
with you, Lisa, on that.
Okay, so moving on to my semantics, under section 6,
So,
I love the idea of
Section 6.
the attestation and.
okay, I got the right one.
I'm using Aaron's.
Okay. No, I think I was going back to the other one.
His
I
is the
think we're
blue
doing the
page.
red one.
We are doing the red one, all right.
Well,
put that
I've got
away.
the clean copy with,
The clean copy, Katie.
Oh, I'm still looking at 6, because I like the red, to be able to refer to it.
It's a lot of red.
so the attestation that the applicant is going to maintain their vaccinations and tests if applicable is great. How about also doing that for number 7? Because there again, then you're putting us in charge of going out and making sure that everything people wrote were accurate and current and is going as they said. But if we turn number 7 into an attestation,
Well, the,
that
I
there's,
still like that part, I think.
I mean, who's going to go out and make sure that their plan is what they're
We're
really?
not,
They
part
don't
of
need to.
it's like trust. Part of it is when they're signing up.
That's called an attestation.
Yeah, they're just
So then.
taking responsibility and saying that they will uphold the
Right,
vaccinations.
that's what an attestation is. So why don't we do that with number 7, so that they're not having, we're not having
Oh,
to
an
go and do
attestation
inspections.
for the safety and sanitary management.
well, my thought would be is that, let's use the example of someone's got rats in the yard. Kitty, can I, sorry.
I'm sorry.
It's
Yep.
okay.
Yeah, that's why I didn't.
Sorry.
If someone's got rats in their yard and Chris is gonna make a phone call to somebody, hey, you said in here that you were doing this, is that going okay?
Mm-hmm.
That's the conversation as opposed to saying, hey, you said you were just gonna take care of this, why aren't you doing it? Because then it becomes an accusation.
I like a brief written description. That was like such a huge component for me on why we were doing this to begin with, because we really have no power over the rat complaints, but I want people to say, I am keeping my feed stored properly to avoid that problem. Like, and if we're just saying that they're attesting to it, I feel like it's not as much responsibility. Not that I want to tell anyone what to do, but just anything that they can do to help.
I think
solve
this
the
is the
problem.
part that people kind of spoke up about the most, because somebody like Joe Kenny may have skills for every type of animal out there and what they need for
Yeah.
feed and how to manage it, but I have no idea how to do that for a zebra or something.
Yeah.
A zonkey.
A goat or something like, I think we also need to be careful about what we're saying we have skills in.
I agree. I hear what you're saying for sure. I think it's a good learning opportunity as well. If one person does something a certain way and then someone else, isn't sure how they want to implement that, if we can say, oh, we heard from so-and-so and so-and-so that this is what they're doing and it's been successful. So I wouldn't take it as I know better than you. I would take it as an educational opportunity for myself as someone who doesn't have chickens. And do you know what I mean?
Well, and actually, I think let's take it out of the equation. Let's say we didn't have this in place.
Mm-hmm.
If someone's got rats in the yard and Chris is gonna go and and knock on someone's door, he's gonna be looking for some of these same things anyway. Chris, correct me if I'm wrong, you're probably not an expert on keeping chickens. You're probably not an expert in all those things, but he's still gotta enforce it somehow because it's a nuisance that came up, and you're gonna become an expert. And I think this writes down kind of the same sort of thing. He's gonna look for this information ahead of time, and he can probably do some research in advance, so.
Well, and, yeah, I mean, correct me if I'm wrong, but on a feed plan, I'm thinking, is it stored properly? Is excess feed being removed? That's
You
what I
don't have
wanna
to be
know.
an expert
I don't care what
at it.
you're feeding the chicken.
Right,
Can rats get at it? Is waste being left out? That's literally all I'm concerned with.
right.
So you don't knock on anybody's door until there's a complaint made?
So there's a,
More or less, yes. And this really was about just having more information at my fingertips before I have to go out and do an investigation.
Exactly.
If at all, might I add, because.
I mean, I feel like we should just think again about this idea of guiding to ensure safety, fairness, and efficiency, because if any of these things require anybody to have to go check on it, inspect on it, it's not efficient, right, for the purposes of.
But if it becomes a nuisance anyways, he's still gonna have to go out.
Right.
So it doesn't
That's-
matter what we put on paper, it's still
Right.
gonna happen.
well, are we going to be held liable that we didn't respond to somebody who didn't really have a good plan on number 7? Like, they got rats, and why didn't we
Well,
take a look at that 6 months ago when they gave us their registration?
I
You know?
don't think that's what's gonna come into play here, because I'm pretty sure you'll know right away what you're looking for.
Yeah, but you're not looking at worst case scenario.
No, I guess you're not looking at worst case scenarios right off the bat.
I don't think,
but-
Lisa, that
I mean,
anybody's
think-
going to attest that they're really bad at feed
Right.
management and pest management and manure management. They're not going to put that down on a voluntary registry if it becomes a voluntary one. So I don't, and if something happens to them, perhaps a person, I'm just thinking of bad case scenarios, maybe not worst, but somebody falls ill and the person who was in charge of taking care of the animals in the yard and the enclosures and all that wasn't able to do it, and neighbors were finding more and more problems, then, we're here to support that person and not punish them.
Right.
And on their form that is going to be in a spreadsheet
Oh,
somewhere,
absolutely.
it's not going to say, we don't really care about all that stuff, we just want eggs. I think what we heard over and over again the last month is our people in Abington who care about having animals and love the process, learn a lot from it, and I feel like we should kind of try to build community and trust rather than government overreach.
Yeah.
And this regulation is not for those people at the end of the day, that's not what it's for. But there's an increasing number of animal owners that go to try this out, which is great, but they're also probably somewhat of the cause of nuisances that we've got to, take care of.
I'm agreeing with all of that. I'm
Yes.
just saying, the way it's written, it sounds like we're going to go out and, I don't know, what's the word? Confirm that this is really happening. You know what I mean?
I'm not reading it that way. I would disagree on that. But I will agree with the notion that I don't want that to become the case. So if
Right.
there's an implication that it should be done that way, we should reword it. I'm just not reading it that way, but I think we need to have something. That's
That's how
Yeah.
some of our opposition speakers were taking it. So I'm just trying to see how we can present it or, we could just leave it as it is, and then if things do come up, we bring it back to the board and change the wording.
Yeah, I mean, because I guess what I'm trying to picture is if someone is making a nuisance complaint, the odds of them coming back and saying, well, did you check this, and this to the health agent on something that this other person submitted? What if they didn't submit anything at all? I mean, I guess I just find it weird working backwards like that, but it could. I don't want to negate that. I just also don't want to work on the off chance that it does.
Okay.
So I think there's still room for discussion on it, but I don't want it to become that either. So I think that's a good observation no matter what.
Okay. I think that's it for me.
So we'd said we're not going to take any action on this tonight. We're not going to do that. There's still some very great conversations I think we need to have. Carol, I think you bring up a lot of great things about, whether this is the right avenue, the way that it's worded. I think there's verbiage that's in here. I want to note too, and just, we have a timeline where we need to be out of this room, so I'm trying to be mindful. We've probably got about 10 minutes here, but, I know Right to Farm is on the agenda for the town meeting. I know that's something that the Board of Selectmen want us to wait before we make a discussion about this and make a decision. I'll explain why my opinion's indifferent on this, but I think at the end of the day, we don't answer to the select board, we don't answer to that authority. There's also several things in here of what we're intending to do that Right to Farm doesn't do for us.
Yeah, it doesn't impact it.
So I think it's great that the community wants to put that into place. I think that's something that probably should happen. But quite frankly, that doesn't affect this or this conversation. The only thing it does affect, which we should address, is that if we do not pass this between now and Right to Farm going into effect, once an agricultural commission is established, these regulations need to be sent to the agricultural commission that is formed in the town of Abington, and they have a 45-day review before it comes back. So it's just another thing that has to happen after Right to Farm is passed. So I think as long as we are all in agreement and clear on the intention that this is for just let us know where the animals are. End of story. Like, that's the sentence, period. So that we can do our public health duties. It's not about regulating the things, regularly accepted farming practices as nuisances, because we don't want to do that. That's all Right to Farm is going to do, is tell people that the things that they're doing that is farm practices, as long as they're considered a farm, they're allowed to do them. So I think if we're clear on those things and we can move forward throughout this process, that way we can get to an answer before having to make it go to another commission for 45 days. But I think we just need to be mindful of what our intent is, that we're clear about that. We continue to be in the process, because we're going to get ourselves hung up and we're going to be banging our heads against the wall. And I don't think it's in the best interest to set the precedent that we do what the Board of Selectmen wants us to do on this. We need to do what we want to do because we care about public health, not because they don't like what we're doing. So I'll get off my soapbox.
I agree with all of those sentiments. I think the Right to Farm, should the town go that route, there's a lot of rules and regs that go with that. So that we don't really need to address.
Right.
Yeah. So I would invite, if we're going to, postpone this to another discussion, invite the folks in this room, actually, and in TV land, to kind of think about the intent. Because it just seemed like that got lost in the paper shuffle, in the wrong version shuffle, the intent of what we're trying to do. And I think that will frame us to finish the form and sign it and call it done, and hope that people who choose to own animals, raise chickens, do whatever they're doing, would be happy to reach out and be educated, or at least made aware of things that are coming up from a public health emergency preparedness kind of perspective. I hope that's kind of what people who join in will want to have happen, and they can rest easy that there's not going to be punishments and inspections and, yeah.
Yeah, I
So-
think we all too, sorry to pipe in on the end of there,
Go ahead.
and this is kind of like a side trail I'm going on, but I think all of us need to do some additional research about the Right to Farm as well. I've started doing some digging, and the stuff that I've read does have me very worried. For example, they have recently decreased the acreage amount from 5 acres to 2 acres, which means that anyone who has 2 acres can run a commercial farm on their property. And there are 140 communities in Massachusetts that have adopted the Right to Farm bylaws. And many of those have agricultural commissions or public bodies that help to resolve farm-related disputes. But if there are not those bodies, then it all falls to the Board of Health. So all of that would fall directly back on us to deal with any disputes or nuisance complaints. So any neighbor who's in a precarious situation with a farm nuisance, it makes them powerless to do anything because it completely removes any nuisance-related disputes. So I would hate for us to be in a position to, that's my little spiel for that, because I'm worried. I don't want us to be in charge of having to regulate commercial farms.
I don't want to stunt the discussion,
Yeah,
but
we
we're
have
going to
to
get
go.
kicked out soon.
Yeah.
So I just want to make sure, is there anything that cannot wait? That you
I just want to, say thank you for saying that, Katie. I think the town is moving a little bit fast on this
I
right to farm
agree.
thing, and without educating about what it means, what people who choose to have farms need to do, and then what people who choose not to have farms because they like to sit on their back deck and not listen to cows mooing and, yeah, right, whatever. So I hope we don't go down that route in such a speedy fashion. I think a lot of work needs to be done on that as well, but it's up to the town.
So to summarize with the animal regulations, we're going to discuss it at our next meeting.
It's going to remain on the agenda. I don't like leaving things without any action, so I think we need to do something between now and then to move the ball
But
forward.
we all agreed on a couple things. Like, we all agreed on
Correct.
getting rid of permit as a word in the document. And
Yeah, do we want a new draft version with those changes in there? We can do that. I'm happy to make that happen.
Carol and I can send you our comments in writing, so you
Please do that, yeah, and then I'm happy to take the draft I had and correct it to have those things that we
That
discussed.
sounds like a good plan.
Thank you.
Excellent. All right, let's try and get through these last few things. Item 9 is approval of requests for additional garbage and recycling containers pursuant to the rules and regulations of combined trash, garbage, and recycling collections, Section B. Is anybody here requesting additional barrels? You want to come up and state your name and address, and which kind of barrels you're looking to get extra of?
Jason Shorter. I live at 11 Nardone Circle. My wife has been asking me to get this taken care of for the last 3 years. I have 3 children, 1 dog, so it's a pretty nice sized house, and we are having trouble with our trash every week. So that's what I need to do.
Chris, I know you've spoken with Mr. Shorter a bit. Do you want to inform the board of any feelings you have one way or the other?
So,
I know there's like 2 sizes. I have a question, sorry. There's like the smaller size one and then there's the bigger size one.
Nope.
No, there's not. They're all the same size.
They're all the same size.
I've seen some that are bigger than other ones.
yeah, we don't have those anymore.
Oh, okay, never mind. Disregard.
I've just been harassing Chris for the last, I don't know, month and a half or so. Sorry.
I swear to God, they're meeting next week.
I know, yeah.
I mean,
Can you just
yeah, oh,
confirm
good.
for me? Sorry.
No, you're probably going to say.
I'm just curious because trash is like such a big problem in Abington,
Mm-hmm.
and I know in recent times we have implemented the no textiles in the garbage. Are you being mindful of that?
What
and
are
not
what are textiles?
Clothes, like clothes,
No.
sheets, any kind of fabric.
I
I just
literally
want to make
just
sure.
dropped off 3 bags of clothes at one of those, big.
Yep.
Yeah.
Good,
Those
good.
Big
Thank you
Brother or
for doing
something.
that.
Yeah.
Yes, perfect.
Those go to your school.
What'd you say? Well, I was actually at the Braintree Mall when I saw one. I was like,
No.
oh, perfect. So you're like even better. Other town.
Good. I just wanted to make sure a lot of the tonnage wasn't coming from that.
No, I just have a lot of like kids and food and you know what I mean? It's
Yeah.
just, and then I get the sticker signs on my trash can if it's too much on it, so.
And are you doing your best to put the recycle in the recycle and not the...
I am.
Well, I want to thank you for coming and making this
Yes.
request, because we have this on here specifically because a lot of people like to make these requests and then they don't actually do their due diligence. The fact that you're willing to come here, I think, speaks a lot to that, so.
You're the first.
Yes,
Yay.
you are the first. The first.
Now we've had the discussion.
So,
Win.
with that, I'm going to make a motion that we approve this request for an additional garbage and recycling container.
I'm gonna second. Yeah, thank you
I have
so
like the
much.
fits. Any
We
further
appreciate-
discussion?
I appreciate all the
No,
information.
do we have another one?
All those in favor?
Aye.
Aye. Opposed? Thank you. Appreciate it.
Thank you.
All right.
Yes. It's just a matter of time until we can get it, right? Because it's under snow.
Yeah,
What, do I need to drop off a check or?
yeah, so it's 150 upfront, then it'll be 75 annually due every July. So drop off a check. I got your name and address. As soon as I have access to the barrels, I'll drop
They're
them.
covered in snow right
I
now.
have a check right now, so.
Sweet. We'll be happy to
Thank
take
you.
your check.
And
Town of
thanks for
Abington.
sitting through all of that. Appreciate you.
All right.
You don't come home until you get a trash bag.
All right.
Sleeping on the couch.
Last item is correspondence. Does anybody have any to share? I do have one thing, 1.5 things.
I don't know.
Did you already go through the time and date of our meetings?
So one of the half thing I have is, it was suggested that our next meeting be March 25th. It would be a week later than we normally would do it, just due to some scheduling things. Personally works better for me. So if it works better for everyone else, I'm happy to make that change. I assume it's a Wednesday, we should have a room.
What day of the week is it?
Wednesday.
Oh, actually.
So give everyone a second, if that
Sorry,
works.
thank you.
Same bat time, same bat cave.
Is it 5? Is that what you're saying? You said
March
same bad
25th.
time.
That's
Yeah,
what I'm
I-
asking.
So
I
is it
think-
5 or 6?
Well, so are we going to run into the same issue we're having right now with being butt up against another
I
board?
mean, I think the Buckley room is free tonight.
Okay.
So we'll just move over to our normal
5
room.
o'clock is good.
I like that one.
So why
better.
don't, yeah, does any issue with doing it at 6 normally?
Not for
Or we
me.
normally would, or does it?
Oh, it does if it's the first Wednesday of the month.
But it's the 25th.
So this
that's
one's
the one.
not.
So
we
I'm
can do
going to
6.
put a discussion about continued meetings for post-April 1st, and this will make sense with my next thing on the next agenda. But at least for next time, does 6 o'clock work on the 25th?
Yes.
Okay.
Yes.
We'll roll with that, and then we'll deal with that.
Is that your list?
Yeah, so I want to thank certain members of the select board for sharing this information, because clearly I'm not able to do it on my own, apparently. I am resigning my seat from the Board of Health effective April 1st, relocating out of town, so obviously that negates me from being able to be here. I have been on the board for 7 years, which is like a lifetime to me, because I'm a baby. But it feels like a long time. It certainly, there's been like a pandemic in there. There's like tobacco regulations were changed. A lot of things happen.
Thank you for your service.
It's been quite a ride. So, yeah, April 1st will be my last day. I'll be gone before that. So we'll have those discussions on the 25th, I think, just to figure out continuity between now and then. You have 2 meetings before the election, when you would reorganize anyways. I think Katie will be at the helm. You'll still have me to set your agenda for April if you'd like, the first meeting there. So we'll be able to get through, I think, just hobble along to the finish line until then. So there was a discussion by the select board about filling the vacancy still through the approval process, depending upon how many people pull out papers. Don't really understand why, because it would be for a period of 15 days before the election, but they might do that. If that's the case, you'll have to go to a joint meeting with the Board of Selectmen and have all that fun, but that's a process they might decide to do. We'll figure that
Well,
out.
Lisa and I have our papers in, and we've been certified. And Jason is our other candidate.
Yep.
Hi, Jason.
Well, we're not gonna talk about that, because that's not really appropriate to talk about right now. But there are things happening, and if you are interested in learning about them, there's plenty of people around town and our board members that should be apprised of that. So just thank you for the time. That's,
Thank you.
thanks for the
Thank you.
memories.
Thank you.
With that, if there's no other correspondence, no, I didn't ask you, then I would entertain a motion to adjourn.
I'll make a motion to adjourn.
I'll second.
Motion adjourned by Katie, seconded by Susan. All in favor?
Aye.
Opposed? It's unanimous. We're adjourned.